Welcome everybody to another episode of Grind My Gears. Got a great one for you today, but before we get into it, log on to www.ashendartmma.com and get your DILF bod shirt. We're representing all the DILFs. I'm starting a new movement, and it's about if MILFs can get a thing, so can DILFs too. So log on to www.ashendartmma.com. Get your DILF bod shirt. Use discount code DILF to get 10% off of everything. We also got the no excuses lines, the nobody cares, work harder gear, everything 10% off. Give your husband a DILF shirt for Christmas and let him know you appreciate that bod. Uh, anyway, all that shit aside, I have Moira Swain on today. Uh, Therapist extraordinaire. She is one of the best in the game. I know she's humble, so she won't say that. But she's shaking her head. Screw you. I'm saying it. But one of the best in the game, and she has worked with athletes from all over in terms of the scope of any sport, from professional ranks to amateur to the regular Joe. So Moira, what's up? How are you doing?
Hi, thank you for having me.
Anytime. You're one of my favorite people in the world, so it's
Very kind.
great to talk to you.
Yeah.
How have things been? Pandemic shit aside.
Pandemic shit aside, it's been fine.
Well, I mean, I feel like everybody has to deal with that shit. So that shit aside, how has things been in terms of just life? Pretty good, hanging in there.
Yeah, hanging in there. It's been interesting. It's hard to separate the two. So
Yeah, it's pretty much a daily thing now. But I
yeah.
mean, that being said, uh, let's jump right into this. As the pandemic has gone on, and you've seen patients after the lockdowns and all that kind of shit has happened. Um, there's from the fitness and health perspective, there's obviously obesity rates have gone up, depression, anxiety, all that other shit. But from the actual physical standpoint, what have you noticed mostly with, even athletes or with just regular patients coming in to see you, conditions they sort of develop throughout this whole thing?
Yeah, so it's been kind of interesting because it's sort of like the other than the top elite, but let's say like a top performer in whatever they consider to be their athletic endeavor, a lot of people haven't had the chance to do what they normally do.
Yeah.
So it's sort of been a normalizer in terms of having everybody becoming a sedentary sitting at a desk type
Lifestyle,
individual, right? So it's very interesting to me because you know, I thought when you sat at a desk job out in an office, that gave you more opportunity to eat bad food and to not exercise because you were tied to your desk and stuff like that. But it seems like people working from home have just consumed. They're sitting more because they can.
Well,
there's no reason to leave, right?
as shitty as a commute is, at least it makes you walk. You know what I mean?
Yeah.
So, like, if your commute is from your bed to your living room, it's like 5 steps. Depending on what. I mean, if you're in Toronto, it's 5 steps.
It's literally yes.
It's literally based on the size of the average condo in this stupid ass city.
Yeah.
So, have you noticed like more, I guess, posterior chain? So, for those people who don't know, that's like shoulders, upper back, lower back, glutes, hips. Has that been like the main problem areas people are having in terms of mechanical?
Most definitely, and I would say even concentrating more on like the neck, shoulders, headaches.
Would that be? I mean, that would be from. I know Coach G coined the term flamingo neck. Would that be because most people are basically staring down at ergonomically, you're staring down at a laptop most of the time, even at a computer. So, what developments had, like, in terms of what problems have people had, like?
So so again, you said physical, but
Yeah.
I can't ignore the psychological part
Oh,
of
for sure. Yeah.
the treatment that I do as well.
Yeah.
Um, people have always said that I should charge more because you
Therapist.
get the you get the mental therapy along with the
Yeah.
physical. But yeah, it's been, I mean, I would say for the first, what people were telling me for the first 6 months is that nobody set up their workstations at home properly because they didn't think they were going to be there for any longer than that.
The 2 weeks to flatten the curve. Yeah.
Right.
Yeah.
Yeah, like I thought this was going to be 2 months and like
Yeah. Well,
everything was going to be normal.
so did everybody, but I mean, surprise.
Yeah, right. So 19 months later.
19 months. Now, I mean, obviously, I know this, but when people are sitting on their ass incredibly more, their glutes are getting no work. Like, and one of the things that I kind of preach when I have clients, like the first thing they tell me, "Oh, this hurts." I'm like, "Well, you need to do glute raises." Do you think that we're going to see a tremendous amount of, for lack of a better way of saying it, flat asses coming out of the pandemic in terms of just conditions developed in the lower back, hamstrings, knees, etc. Just because you're not, when you sit on your ass, you're not using it, and the muscle will waste away,
Well,
right?
basically atrophy, yeah, for sure. And if you weren't actively, I mean, you would know from a personal one-on-one standpoint, but how many people, if you already had a home gym or something set up, then you're probably better off than most people. But how many people did that?
Uh,
Like people either were going to a facility or they were having their activities,
yeah.
right? Like even just going and playing volleyball once a week or going and playing soccer once a week, that activates the muscles, not in a formal sense, but it at least does something.
Well, I mean, here's the thing about the home gym stuff. Like, I love fitness and all that shit. I work out more than people. People will call me crazy in terms of how much athletes and people like me work out and train. But there's a big fucking difference between picking yourself up and going to a place to physically do it and my living room. There's a totally
Yeah.
different thing. So for the, like, I mean, don't get me wrong, I'm sure there's going to be, after this is all said and done and in the history books, there'll be some people who have taken to online training and doing stuff more at home once in a while. But let's not beat around the bush, people. Like, working out at home is not a thing that you're going to do consistently all the time. It's just
So exactly, that's my point is that the the people that I treat, I would say there's a low 5 to 10% of people that did something at home,
yeah.
right? So now that you were stuck there, the and everyone just sort of, again, it's the psychology, everyone just sort of accepted it. So there wasn't the motivation until probably I'd say the past 8 months to go and do something about it,
Were you getting a
right?
lot of people coming in with ailments like during the lockdown, or like just reaching out to you like during the lockdown parts?
I had quite a few people reaching out during, yeah, when like we technically weren't allowed to treat.
Yeah.
Yeah, so it was a lot of emails and text messages and
Like,
stuff like that.
I know you can't obviously divulge each person's case because that's
Mhm.
not allowed, but like, what would, to sum up the most amounts of, what was the most common thing that was developing injury wise?
Yeah, honestly, it was neck. It
Neck?
was neck and shoulders. Yeah,
And saying that, do you think it's because of stress too, combined with,
100%.
yeah?
Yep.
So
Yeah,
stress
it
combined with
was it was poor workstations combined with the stress of everything,
with
and people feeling helpless as
yeah,
well, like not necessarily having the tools. And then when stores were shut down,
yeah,
right? Like unless you were an Amazon fiend, right? Like you're ordering stuff to try and make yourself better, but there wasn't an easy way of going out and dealing with it.
well, and then you can order shit and it's not the right thing or not
Right.
the right size or
Yep.
whatever.
Yep.
Now, saying neck and shoulders and that kind of thing, with people transitioning to like a more, probably a hybrid workplace now. I know in January a lot of people are going to be going back to
Yeah.
work, going back to the office at least on a part-time basis. Um, do you think the problems will probably, these aggregate problems will persist well into, considering that there's going to be a hybrid model instead of just staying at home all the time?
I would imagine they would actually improve once people start moving.
Is it just based on movement alone, right?
I would say so. Yep. There's nothing you can't take away from healing your body of just some kind of movement.
Yeah.
Obviously structured, specific, targeted
Yeah.
is the best thing to do. But when you're not dealing with elite athletes, you have to convince people how to do things that they're willing to do, right?
And
And just moving,
yeah, just get up, right?
just get up.
Um,
Yeah.
so like with, I mean, the pandemic is one thing, but like, uh, when you diagnose, like the one thing I always praise you for is you're a brilliant diagnostician.
Thank
Um,
you.
for 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 what people, if somebody who's listening doesn't understand what the hell I'm talking about, I'll give you a good example. I've torn my ACL before. Like I've torn it, it was torn in half. It was gone, it was torn. I had the surgery, and then I had a training incident, and I had an MRI, which was, valuable, but it kind of wasn't 100% accurate, because MRIs, lo and behold, are not 100% accurate. And then I proceeded to see three surgeons, and all three surgeons did their little, they fiddle with it. Yeah, you're torn. Let's get you in the hospital. Let's get you. And it was you who did your manual test and said, I still feel something, right? And then, so that person, that your diagnosis, I wouldn't say it changed my mind. I was still accepted there was an issue, but it made me question the validity of the other surgeons and their motives behind the the diagnosis. And then I went to Cleveland Clinic and talked to Dr. Miniachi, who's boss. If anyone is
Yep.
in Toronto, go see that guy. I don't even know if he's still working here after all this shit, but um, and he looked at the MRI, looked at the knee in depth, and said, "This is not a knee I would even touch or operate on." And lo and behold, where this is like 5 6 years later, while I do have some incidents of instability, I have a full intact strength knee. Now, that story being said, how do you approach diagnosing a client and an injury when it comes to you on a table?
So, okay, so I'm going to do one exclusion is that technically I can't diagnose.
Yeah, no, no, like
So we call it assessing
assessing.
as a technical term because only physicians and stuff like that can diagnose. So from an assessment decision and then going on to a plan from there, I think you said it perfectly. Whatever term you used is that depending on who you go and see,
Yeah,
they're gonna do. You can have 4 or 5 people do exactly the same test. I can't drill in your knee and fix it,
yeah,
right? So you're seeing 3 surgeons or 2 surgeons and a sports medicine physician who their line of thinking is, can I fix this or can I not fix this with the tools that I have?
okay, I got
Right?
you. Yeah,
So a sports medicine doctor may say, well, I can inject you with PRP, I can inject you with steroids, I can take away your symptoms so that you can go and do whatever you need to do. A surgeon will say, I will open you up or I will not open you up, depending on
the
how
level.
they feel, right? So as a therapist and as an athletic therapist, my schooling was very much in the specific assessment tools
Okay,
and really more so the treating of which. So if my assessment is that, yep, I am 90% sure, because I wouldn't have said that to you in
yeah,
particular, and I try not to say it to people unless I'm that sure.
yeah,
Um, that in your case, there's a ligament hanging on here.
yeah. And it was a sizable amount too. It wasn't as advertised in the MRI and the diagnosis.
Yeah, because you're right. It's statistically MRIs are 77% accurate.
Yeah, and I don't think people realize how actually low that is. That's incredibly low in terms of making a surgical decision.
Yep.
And we'll go back to what you were saying, but When I tore my pec, because I've torn everything, um, just so people have a perspective of how, they're not 100%. When I tore my pec, it was torn, but when the surgery actually happened and the surgeon talked to my wife after, he did say that there were some fibers left. Whereas when you get the actual results of the MRI, uh, it says it's a complete tear. So
Yes.
it is not 100% in terms of visuals and what the report says, right?
Yep.
So anyway, back to what you were saying.
But that's what you and I said too. If we're going to continue talking about your and my relationship
Right.
as treating, I could feel fibers in your pec too.
Yeah.
Right? Like I knew that wasn't completely. I knew it was significantly.
It was sizably.
There was we had
Yeah.
things to deal with, but like, so again, that's not to toot my own horn or whatever, but it's just you gain a sense. ACLs in particular, I've treated and assessed tons of those. They're my absolute most favorite thing to treat, because it's tangible, it's fixable.
My favorite thing is broken knees. I love that.
That's right, exactly.
You've broken
Well,
your knee. Come see me.
Well, I don't want to, the dealing with the people with the transient numbness down the legs and things like that's much harder to deal with, and it's harder to convince people that you're going to help them.
Yeah.
Right? It's that much more complicated. Whereas when you have something that again, varying degrees of severity, I can assure the person that they're going to get better.
Yeah.
And that's great for both of us, right?
Yeah.
It's great for me, it's great for you. But in terms of, so again, taking you into consideration, most people who tear their ACLs are not sedentary people.
Yeah.
Right? They're active. So they're usually willing to do the work. So if you can convince them that it's not the end of the world, there are proven and, foundational exercises and rehabilitation processes that you can do, and people live freely without and successfully without an ACL at all.
I know
as long as you're strong enough.
My old head coach, Chris Bonfoco, who I've had on this podcast before, he has not had an ACL for more than half of his life. He actually, if I remember correctly, him telling me he tore it way when he was a kid and didn't even know, and he was just having meniscus issues, and that's when they found out it was torn.
Mm-hmm.
And I'm 100% sure he never touched it since. He's a black belt in jiu-jitsu, and now he's doing Ironmans and shit. So I mean, that's like, you do need it, but depending on when the injury happens, there is a situation where you don't need it, right? I guess.
And men do better than women.
Yeah. Well, isn't it statistically women tear their ACL statistically more than men, right?
Yeah. And in kind of like a peri-pubescent situation. So it's almost like 13 to 15.
And why is that? Is it because
it partially has to do with hormones, actually. So there are a few studies that say that when hormones are kind of in flux, that's a time where the girls will tear. I won't go into details, but will tear it more often in that regard. And then structurally, it has to do with the fact that women have, so it's called a Q angle, but basically our hips to our knees.
Yeah.
That angle of that inner is sharper than with men, are very straight up and down. So you don't have that outside or valgus force to the knee that women do. And so it just doesn't happen as much. Not to mention the fact that when you do tear it, men have better muscle development, right?
So does that mean that when women have an external force to the outside of the knee, they're more susceptible to torn ACL?
Exactly. Yep.
Well,
because it's that lateral to medial along with rotation that typically tears it.
And this is just a random question, but would high heels have anything to do with the degradation of that as well?
I've never read anything about that. I'm trying to think of it right now. I mean, it would shorten the posterior chain, like hamstring tightness. So hamstring or hyperextension is usually how you re-tear it if you've had a reconstruction, but I'm not sure that would.
Oh, I'm just asking because
yeah.
High heels are an enigma to me. I don't fucking know.
Well, the devil's.
Well, I I don't physically. I like. I'm comfortable with my sexuality, so I've put them on and I've tried it. Walking in them, and it's fucking torture. So I don't like. Congratulations to women who pull it off, but it's fucking ridiculous. It's like just put a flat shoe on or something with
Uh, a comfortable heel, like a
yeah,
running shoe.
something
Yes.
comfy. Like I don't get it. I understand open toes looks good, sexy, whatever, but shit, your fucking feet probably hate you.
We do it to ourselves.
Yeah, I know. Well, whatever. You gotta look good too, right?
That's right.
Uh, so when you work with athletes, we'll change gears a little bit. Um, I'm not asking. I'll ask the injury part after. But what's the number one issue you deal with in terms of athletes? Like, as an athlete myself, I can tell you, I'm a whiny bitch when I get hurt. Um,
No, you
when
are.
you get an athlete in there with an injury, what's the number one issue? Is it like convincing them that things will be okay? What's the most important thing that, or the issue that comes to mind when you treat one?
Yeah, that sort of like leapt into my mind just now. But honestly, the hardest part is getting them back to what they were doing before.
Yeah.
So it's very interesting. Like I can usually convince people that things are going to be okay, but it's when you're so if it's something that's prolonged, like if it's something like an ankle sprain or a strain to a rotator cuff muscle or something like that, that's 3 weeks to a month.
Yeah, nothing much, right?
The average person, even if you're 15 years old, you can see beyond 3 weeks, right, and know that things are going to be okay. With more complicated things, it's convincing people that they can go back and do what they wanted to do. Um, and I mean, I had one patient. This was when I first started, and she had torn her ACL playing basketball,
Right.
and she had such a mental block about it that she refused to go back to basketball, but her first sporting endeavor was indoor soccer.
That's
Which to me was completely like worse
yeah,
than going and playing basketball in a nice straight up. There's pivoting,
yeah. There's
but
a lot more.
a fairly regulated up and down type of motion and avoidance of certain situations. But that's the psychology of what we do too.
Yeah. Now, I mean, you've seen a varying array of athletes come by. Do you have a certain like athletes in a certain sport or come from a certain background sport that kind of manage those mental issues from injury better than others?
Ooh, that's an excellent question. Soccer players are really bad. That wasn't what you asked.
No, but it makes perfectly fucking sense if you
I'm
watch the
I'm trying to
Italian.
like now do a deduction of
If you watch the Italian soccer team, it makes perfect sense.
yeah, and
They're like,
and I don't know what it because I mean I was a soccer player. I played
yeah,
soccer for 23 years, and it's not it's a tough. I'd say at the lower levels it's a tougher sport than it is at the higher levels. You know what I mean?
yeah,
It's pretty grinding, but and I would say definitely. I mean the handful, and I'm not just saying this because you're here, but the
yeah,
handful of people who so like a combat type arts, a football,
yeah,
a hockey. It's super cliche, and it doesn't have to be. I mean, female
yeah,
fighters. I've
yeah, yeah.
treated two of them, and female hockey players. I treated a ton of them, and it has to go with the mentality of the sport. I would imagine, like why
Yeah.
you even bother getting into it. You're tough,
Yeah. Yeah. I
right?
it kind of I mean, the amount of shit I've been through and I'm still like at it, it's a it it sounds like you just said cliche. It's a toughness thing. Like to be like a lot of people ask me why I keep doing stuff and why I even competed in the first place, and I tell them, it's one, it's scary, so I do it, but two, it's the hardest thing I've ever done. Like the scariest place to me is being fully trained, being well equipped, being on the bottom, somebody fully mounted on top of me, and beating my fucking face in. If that's not what's happening to me, I'm okay. So like when these kind of things arise, I'm sure because you've treated me through almost every one of them. Um, I've pretty much, as they kept happening, I just was like, okay, what's the timeline? All right, let's get healthy and let's do it. I mean, each and every one of them had their challenges, but I mean, I had this last one was the Achilles, which happened during the pandemic, so I obviously didn't get as much time or therapy as I did on previous ones, and I kind of blew it out of the park. Like I still have some stuff to work on, which is why I was we were planning to compete in November next month, but there's still some stuff I need to iron out with it because I didn't have the tools available to me during the pandemic because of lockdowns, etc. But as I mean, as you experience the setbacks, I feel like most athletes, I'm not gonna, they learn to kind of mentally block out. Okay, whatever. It is what it is. And I like to use. I don't know if you know who Dominic Cruz is. He's a UFC fighter, but
Mhm.
he was the champ, and he tore. I believe he torn his ACL like 3 or 4 times. The guy's injury prone to the max, but it's because of his style of fight. He's constantly moving. Like watching him fight is like watching this, somebody on speed, like just on the fucking. It's just constantly moving, and it's because of his training regimen, and so he really puts his body in really compromising positions, right?
Mhm.
When he trains. But the guy literally will tear something and just come back. And he's been doing it for like 8 years, where
Yeah.
he could have been legitimately the pound for pound best fighter in the world if those things didn't happen to him. But he's still going at it, and I think that's what I mean separates I as a human being too. Like that makes him a better human being because you go through these setbacks, and I'm sure you've seen people come and just absolutely crumble in front of you after an injury that whether it's big or small,
Mhm.
but it's the ones that kind of just okay, I'm gonna just get past this. Moira said I'd be okay. Those are the kind of ones that after sports done really take it to another level in my opinion.
Yeah, and I mean, so as you're talking, I'm kind of rolodexing people and stuff like that in my head right now, and
Yeah,
honestly, I think it comes down to, and it doesn't matter the level, and it doesn't matter the age, but what's your motivation,
yeah, you're why.
right? So is this, I had a patient years ago who fractured like his tibia and his fibula, so pretty significant.
Yeah,
Was in a cast for however long, and he was a real person, but he was an OHL referee as
yeah,
well. So big hockey guy. And I believe it was Steven Stamkos had exactly the same injury as him at virtually the same
yeah,
time. And I think he must have been 2 months in because I think he was pretty early on in his rehab process. And he's like, Steven Stamkos, so it was 3 months,
yeah.
whatever. Steven Stamkos is skating again. And I said, "I'm sorry, are you Steven Stamkos?" Like,
Yeah,
I'm pretty sure. First of all, body type, don't see it. Motivation to be making whatever he was making at
that's a
the
different.
time,
Yeah,
right? So, I mean, that's a level of professionalism versus amateur. But then, does the 16-year-old who has 2 more years of school and her ACL tear, she thinks it's going to affect her ability to get a scholarship
yeah.
to a university? Her family doesn't, I had this one kid, her family lived in a basement apartment of a house.
Yeah, so that's her only shot to get out. That
That's her only shot to get out.
yeah, and
So it doesn't, it can be, millions of dollars. It can be an aspiration for millions of dollars, or it can be, I
it's
can't afford,
an education, so this is my way to get one.
and this is what's going to happen, right? But it works the other way as well, is that some people lose their motivation because they're like, actually, I can continue on okay without the
Doing it.
sport. I
Yeah,
want my body to do what I
function.
want it to do. It doesn't have to do this particular thing, right?
Have you seen some frequent occurrences of like an athlete that comes to you has a major injury and then they just kind of quit?
Yeah,
Uh,
sadly.
Is it frequent or is it just 1 of 10 or something like that.
I would say it's infrequent.
Okay.
But so I'll qualify that by saying that people almost always stay active.
Yeah. But
So sort of like the basketball player kind of thing playing soccer. It's
yeah.
like in her head, she thought basketball was the problem,
Oh, okay.
but she played soccer for 10 more years.
Yeah.
Which again doesn't make sense to me, but
Makes sense.
party
So
on.
so saying all that, what's the most common injury in athletes? I think I know the answer, but I'm not a pro like you, so
Oh, common injury. Uh, in athletes, you're
in
specifically.
athletes,
Not that I see.
just in athletes that you see and that you're aware of based on your education and your experience.
Yeah, I would say some sort of knee injury.
ACL probably.
I would say ACL, MCL,
Yeah.
even just biomechanical stuff like patellofemoral syndrome.
Yeah. Now, the ACL is an interesting one because when I tore mine, and it wasn't tremendously long ago, I think it was, I mean, in my probably 10 years now, but that's a long, I've known you for a long time. Uh, when I tore it, I thought it was the end of my life. Like,
Yep.
because at that time I wasn't aware of the advances in the medical procedures because I was just kind of going off of what you hear, like, like you watch some of those old football guys and they tear their ACL and their career was over after they tear their ACL. It's interesting because it's such a common occurrence. Like, I don't know the exact statistic, but in the NFL, I remember the last time I read about it. It was something ridiculous, like at least 50 ACL tears a year in the NFL, and it's probably more. Um, why is that specific? I know that it's probably because it's uh, highly occurring, but why has that specific injury gotten so advanced? You think, in terms of the procedures?
Oh, um, that's a really good question. Why it's gotten so the repair of it hasn't, I don't think, gotten so advanced. It's the rehab
It's the
principles.
rehab principle, yeah.
My mentor, okay, so now I'm dating myself, but I mean he was working early on when I was like in high school and stuff like that. He was starting his career and they still casted you
Yeah.
for ACL. So that's like the 90s, right? Like, so if you think about, yes, 25 years ago was a long time, but it really isn't
Yeah.
in the grand scheme of things. So you used to be in a cast for 2 weeks and they would cut out a little square in your cast so that they could put the muscle stem in.
Oh man, that's
Because think
ridiculous.
about how much your leg atrophied.
Yeah, a lot.
So think about what you do from a workout standpoint and think about just because the ACL has such a neurological connection to your quad that
Yeah.
once it's gone, your quad shuts off, right?
Mm.
It's a protection mechanism, basically.
100%.
So you have a surgery and your quad comes back a little bit, but it takes quite a while
Yeah, I
for even the
remember.
fittest people or
I,
strongest
rem-
people.
I remember the first few days of the surgery. The only thing I was supposed to do was kind of wiggle my knee around a little bit, and then try to. I think we call it quad sets, where you just try to contract your
Yeah.
quad. Like
Yep.
that was it. And
Yep.
I remember, me and my wife were dating then. She came over after like 3. I'm like, look, and she looks and she's like, what the fuck? I don't see shit. I'm like,
I see
I'm
nothing.
moving my kneecap. I'm moving my knee, right? So I understand what you're saying with the neural connection to the quad, right?
Yeah.
And
And so think now 25 years later, I have always encouraged and have actually, bet, some people call it threatening,
yeah,
but bet people that, you will be walking
within
without your crutches in the first 5 days
yeah,
because you can.
yeah,
To go through the science a little bit, that first 6 weeks, you've got a brand new, fresh ligament, right? Ligament
yeah.
in air quotes. But you've got a fresh tissue that is now doing what that ligament has done. So let's get your butt in gear,
And move.
get the muscles working while they've got that support. Because ligaments, basically, from an anatomy standpoint, are like pieces of tape.
Yeah.
right? They hold the joints together, and the muscles are the dynamic support. So you've got a brand new piece of tape holding those two bones together. It's stable. Let's get your button gear, because that physiological change within that new ligament
Yeah. Well,
starts changing at that 6 week mark,
yeah.
and you
Well,
start getting weaker and weaker and weaker.
now this is a random question, but I know like for the ACL, it was after 6 months the tendon technically forms into a traditional diagnostic ligament.
Yeah, yeah.
Is that
About 85 to 88% is what
is
they
that the
say. Yeah.
same for every replacement that they kind of do that with?
Yes,
Okay.
physiologically. So again, I have a great bias towards patellar tendon uh,
Grafts?
grafts.
Yeah.
So, but it's a double edged sword in a way, because technically that structure is stronger just because it is,
Yeah.
versus a hamstring. There's more stretch to it, right? So when they put the hamstring graft in, like you had,
Yeah. And
they take the stretch out of the tendon so that it's not all flippy floppy.
yeah, yeah.
But okay, so from a technical strength standpoint, but as you know, from a rehab standpoint, you can rehab a ton faster with a hamstring graft than you can with a patellar tendon, because your quad, which is the muscle that's attached to your patellar tendon,
Yeah.
is always loaded,
Yeah.
regardless of what you do. Whereas your hamstring is only engaged when you're doing knee flexion type exercises. So from a rehab standpoint, it's 10 times easier.
But I mean, it does come with its downfalls. I do have like a hole in my hamstring, especially when I lose weight or cut weight for a fight.
Right.
It
Yeah.
is
You had
evident.
noticed that. Yeah.
And then I still the belly has filled in a lot more. But and I'm gonna call doctors out on this because they need to stop fucking doing this. When they tell you you're gonna regain a certain percentage, it's a fucking lie. You're not gonna regain the 98, 99% that they tell you. It's a bull-faced lie. You'll be lucky if you get 90. And I'm just not saying that naively. I'm saying that as somebody who's gone through multiple different surgeries in my athletic career. You're not going to regain. You're lucky if you get 98 to 99% of function back if you use a graft in any surgery, in my opinion.
That's
And
fair. Yep.
yeah, and I think it's something that doctors do too much. Maybe they do it to ease the patient's mind and make them feel like things are going to be okay. But I feel like it's better if you just be honest with them. If you're going to do the hamstring graft, you're going to lose at least 8 to 10% of the strength that you had. And that's, I mean, for me, thankfully, in my sport, I've made it like that hamstring is super flexible. So before the surgery, I couldn't throw an axe kick and flip my leg over someone's head. Now I can because the hamstring is a lot looser in terms of flexibility than before. But I think it's a very shitty thing of surgeons and doctors to say that to people, and just to be honest with them, you're going to lose quite. You had an injury, you're going to lose some function if we do this.
And to give it, so this is going to go on a tangent, but
Yeah,
and to give it a sports specific analysis,
yeah,
right? So there are a lot of surgeons out there that do a certain graft because that's what they feel comfortable with, or that scientifically that's what they feel is the best result.
yeah.
There are some surgeons, fewer that I've dealt with, but there are some surgeons that assess or analyze what you actually have to do afterwards,
Okay.
right? Or even structurally, when you're dealing with a 14-year-old girl, it's like, well, is the patellar tendon long enough
Yeah,
to actually do the proper graft, right? With you, and I remember telling you this when we were rehabbing, is that my anyone who did martial arts,
yeah,
they were the only ones who complained about that last little 5 to 10 degrees of flexion that they didn't have,
yeah. Because you
right?
we
Like
yeah,
jujitsu is like a huge
flexibility thing.
knee flexion,
Yeah.
especially, right, with force. And then you add in all the grappling aspects of having to have that ability to have a quick, fast twitch of your hamstrings.
Well, I think the key thing for the knee surgery was, if I remember correctly, is like imagine yourself just on your knees. You're on your knees, and somebody is trying to take you down. So there's quite often times where you're getting taken down, you're on your knees. It's like that yoga pose where they're on the back, like, and but this is with somebody trying to tackle you. So your knees have to be able to, your ass literally needs to be able to touch your heels. It's there's no other way to put it because and white I see white belts come in and they don't have the flexibility and then they develop it over time because it's not that hard. It's an easy position to like be in every day and just develop the movement. But after any kind of surgery, like an ankle or a knee, you have to have that doing a grappling sport. I would even say football because of the way they fall, right?
Yeah, fair. Yep. Yep.
I
But
mean,
how many other sports could you name that needs greater than 120 degrees of flexion
not many, not
from a
many.
functional, right? Like from literally functioning, not getting yourself into a,
From a functional
right?
and I mean, and then there's the other part of martial arts and combat sports where you can't wear a brace.
Yeah.
Like you can wear an ACL brace. Like I'm pretty sure Tom Brady, because I know he's torn his, he still wears an ACL brace because he can,
Yep.
right? And that's great because I would love to, because it gives him that sense of security. It protects the joint from going into those directions, and it stabilizes the knee. But then there's other sports where you just absolutely can't. You can't. You
Yep.
can't wear a
You can't
brace.
in rugby. You can't in soccer. Yeah.
And I'm pretty sure you can't in basketball either. It'll be
Well, I don't think so either. No, you're right. Anything that I think has like football has outside protection, hockey has outside protection. Anything that's going to hurt people anyway.
well, I mean,
Who
I guess
cares if you've got a brace on, right?
anything where you're wearing padding, I guess, where
Yeah.
you
Yep.
can wear them. But I mean, so for those other athletes, you're kind of screwed if you don't get the function and the range of motion back
Yeah.
because you're probably going to either hurt something else or re-tear it again, I guess, right?
Yep. And as you know, as a strength coach as well, is that range of motion allows for strength.
Yeah, the more range of motion you
right?
get, the more activation you get in certain.
Yeah.
Now, is a injury where they have to cast it worse long term in terms of rehabilitation?
So you're talking about like a fracture?
A fracture, or even I'll use me as an example, an Achilles.
Yeah. So anytime that you're in a soft cast, like
Yeah.
in a boot, like you were.
Well, I was in a hard cast for 6 weeks.
Oh, we're in for 6 weeks.
Yeah,
okay.
I made them take it off of me after the fifth because I said fuck that. I couldn't deal with it anymore. But I was in a hard cast for about 4 to 5 weeks for sure.
Yeah. So I wouldn't even see, now I'm becoming difficult because I wouldn't even say that casting versus whether it's because they don't often cast, like that would be the last soft tissue injury really that they do casting for.
Yeah.
Right. So I would say less so like a casting issue, more so what the structure is. So I have said, for 16 years or whatever, that it's better just to break something, slap a cast on and get yourself back into the swing of things, right? Whereas soft tissue takes so much longer to rehab. When the ligaments, I mean, not that sometimes when you fracture an ankle, your ligaments are also stretched or torn, but if nothing's happened to the soft tissue or the muscles especially,
now
Bob's your uncle. Like, get the cast off and go for it.
Now, you saying that with the bone breaks, there's a phenomenon going in with mixed martial arts, especially just because of the nature of the sport, where recently, I'd say over the last 5 to 6 years, a tremendous amount of fighters have been throwing a leg kick and shattering their shin bone. The most recent Conor McGregor, I'm sure you've maybe seen that highlight of him.
I only saw his tight suit throwing a pitch.
But he's the most recent one who threw the kick and
he shattered his own.
He shattered his own shin
tibia.
bone.
Okay.
And then when he stepped down, obviously it crumbled. And would you say that would be better than a soft tissue injury still, even with that massive? No, that's tremendous because they have to reconstruct the bone, right?
But again, I don't know the case. I don't know what, but yeah, like if you've got fragmental fractures, anything that has to be surgically dealt with,
Then
as
yeah.
opposed to just slapping a cast on and letting the bone heal itself.
So basically, what you're referring to, if you made contact or you fell on the floor or something, and your arm broke, but it was a simple break, they just set it and put it in a cast.
Yep, you look on an X-ray; it's a nice little line through the bone.
Okay.
Throw an immobilization on it, you're good to go. And
Okay, so we're not talking shattered fucking or like
yeah, anything reconstruction wise
for the
is
bone, I guess.
tough,
Yeah.
right? And if it's you think about biomechanics, if you're talking about mid shaft
Yeah.
of a long bone, like a tibia, or well, femur I won't use, but you know what I'm saying, like a tibia, um, like the ulna or the radius or something of the arm, where it's just a long bone and it's mid shaft, things are broken, perfect. But once you start getting into the joint, that starts getting more complicated, right? There are surfaces that are
Yeah.
joining whatever's being reconstructed, and sometimes you can't get that range of motion back.
Like I know with hockey players, they quite frequently have clavicular and shoulder injuries up here.
Yep.
Um, is because of the location of that. Is this a terrible injury, like in terms of to heal the clavicle?
It can be. Are you talking about from a
Yeah, from a
fracture
fracture
standpoint?
standpoint, not a separated shoulder, like a fracture.
Yeah, because I would say separations suck even more, but yeah, fractures again. I'd say in again, I'm not the be all end all of existence on this, but
Yeah.
I've seen one or two. So I would say a ligament reconstruction, and then maybe one or two clavicles that have actually had any kind of
Break.
apparatus put in.
Yeah.
I saw one. There was this kid that was a snowboarder, and he had this awesome. It just looked like a tree, like it looked like a Christmas tree, and it was one of those things that had been poorly managed. Like an X-ray is an X-ray. You see
Yeah.
what you see, and they're like, oh, it'll just go back to normal.
Oh well, jeez.
But it was literally splintered. Like you think about breaking a tree branch,
Yeah.
right? It was literally splintered with the little bone fragments on top of it, and they just let it heal. And it was a ton of calcification, and it was a long time of rehab and allowing him to go back to an impact sport like that.
Well, on a
But it
side,
healed with
on a
surgery.
side note, I have a similar. It was actually an Achilles. A friend who had an Achilles tear. He was playing basketball, felt something on his ankle, not right. Went to the doctor. They're like, "Oh, you sprained your ankle. Just rest." So then he doesn't live in this province. He moved, so he flew back to where he lives in Alberta, and it was still bugging him. So he went and saw a doctor out there, and this doctor did her diagnostics and ordered an MRI right away because she had a feeling. And the MRI came back, I think, a day or two later because she made it urgent, and he had a severely torn Achilles, and she rushed him into surgery the next day because the timeline of when the actual incident happened to when she saw him and what she told him after was that he should consider suing the person who told him that it was
Yeah.
nothing to worry about because if he had come to her, 2-3 weeks later, it might not have been repairable, the degree of what was happening. So did you find that that's a common issue? Like the time
Of a misdiagnosis?
a misdiagnosis, yeah.
Um, yes.
Well, I've had a
Did
few
you
of
want me
them.
to elaborate on that?
No, no. Well, why is it just laziness or is it uh just not understanding these specific injuries?
So, what in Ontario, anyway,
Yeah,
what is our first line of support in these cases?
I'm
It's a
guessing family OHIP
family
doc.
doctor,
Yeah,
right? So again, not any of your listeners. I'm not putting anybody down, any kind of profession down. We all have our specialties,
yeah,
right? So the issue is that is our first line of offense. Not the average person can't phone up a sports medicine doctor or hasn't had a surgery within the past year that they can phone up a surgeon and ask them to look at them, right?
yeah,
Um, if you don't have good family friends that are such and such and such and such that can get you in wherever, right? Like
Yeah.
that's few and far between. So you've got someone who is, um, you know, I'll call it a master of all, even though sometimes they aren't masters of all, right?
Yeah.
So I've had several patients whose physicians won't even send them for a diagnostic test.
Jesus, that's ridiculous.
They they cite radiation issues, even though we all have cell phones connected to our
Yeah.
bodies
Sure.
on
We're
almost 24/7,
literally having microwaves go through our brain
right?
on a daily basis. Yeah.
It's yeah. Um, so that's the first problem. The second problem is just not identifying that it's anything, that there's actually a problem.
Yeah.
Thirdly, the ones that just sort of blanket send you to therapy, there's not an understanding of what's good therapy and what's bad therapy,
Yeah. And
right?
that was what I was gonna ask you.
So
Right.
you can be sent to Joe Blow therapist on, how many therapy clinics are there as you drive down,
There's thousands,
right?
thousands. Yeah.
That doesn't mean that there's a decent person in there
Yeah.
every single place that knows what they're talking about.
Yeah.
The thing that gets me the most, by far my biggest frustration, is as a therapist, because we have lots of knowledge, we should be able to fix people
Yeah.
regardless of what schooling you've had. Whether you're a chiropractor, a physio, a massage therapist, an athletic therapist, you should have enough schooling, education, whatever you want to call it, experience,
Yeah.
right? Like if you've been doing it for 5 years plus, you should have enough experience to know when you can't help somebody anymore.
Yeah.
So I've had patients, this was earlier on in my career, where people had been going someplace for 6 months to a year
Yeah. Well, I
without
know
any results.
I know
What are
that
you doing?
I know that all too well from clients for one. Uh, I find it funny because I'm not a medical expert or a therapist or anything like that, but because I've fucked myself up so many times, and I mean, I'm thankful for it because now it gives me another range of specialty to help people with. But people are I have clients and just regular people who have hurt themselves. They've been going to therapy or physical therapy or chiropractors, you name it, for months and months and months, and they're still dealing with that pain. They talk to me. I give them like 3 exercises. I'm like, just do these 3 things for like the next 5 weeks and shut up and tell me what happens later. And then the next time I see them, dude, that healed me. And I'm not saying I'm a physical therapist or whatever, but it's experience and paying attention to the details of these. And one of the things I wanted to talk to you about is I know, like, when I come to you with a problem, I give you the fucking kitchen sink. I'll talk your face off about everything I was doing when that thing happened. And I don't do it because I do like to hear myself talk, but I don't do it because I like to hear I think my voice is too high pitched. I'd like a deeper voice if I could talk to God and ask him for a favor. I'd like a deeper, more Morgan Freeman type voice. Uh, but it's because I try to give you the most descriptive um, uh, presentation as if you were in the room when it happened,
Mhm.
so that you can understand. And I use this word with everybody I talk to comes to me with an injury problem. Mechanism, right? A mechanism of injury is really important because what I find with people is I'll do. I have a girl. I did her first boxing session with her like a couple weeks ago, and then she sends me a text like 3 days later, like my shoulder's all fucked up. I can't move it, and it won't. I can't touch my head. I can't scratch my ass. I'm like, she's like, do I need to go see the doctor? I'm like, I said no. She's like, why not? I'm like, I was there. There was no mechanism of injury. You're just punching shit. Something you haven't done before in your entire life. I'm 99.9% sure your muscles are just fucking mad at you and you need to just rest and ice and eat some good food, hydrate, whatever. And lo and behold, I was right. Um,
Mhm.
how important is it for you as to treat and to what was the word you used? You didn't. You said
Assess,
assess
assess, not
to
diagnose. Yeah.
know the mechanism of the injury, or if there even was one.
It's of vital importance for sure.
Yeah.
In the general population, though, there isn't always one that they can come up with, right? Yeah. Athletes are very good at telling you what they were doing and what happened, right? Because there usually is. With almost anything else, there isn't usually a major mechanism of injury. And again, as you're talking, my head goes into thinking and stuff like that. And yeah, it's awesome when someone comes in and tells you the complete and utter story and where you were and what you had to eat in the last 36 hours and you know what I mean, when you actually understand what I'm looking for.
Yeah.
Right? And there are quite a few people that understand what I'm looking for. But it's not always the patient's job to tell you everything.
Yeah, it's your job to probe, I guess, right?
I'm supposed to ask the right questions.
And do you think that's an issue in the industry? Yes, you didn't even fucking finish the sentence. Just yes, Ashton.
Yes, I do. What? And I've been guilty of it.
Is it because of it's not a part of the schooling, or is it just because of people skills, you think?
I think some of it's people skills. I don't necessarily think that it's the schooling. Okay. Again, I only know what I learned.
Yeah.
But I think that, again, depending on where you work and what the objective is of the facility, sometimes you don't have time to ask the questions.
Yeah. Like, I mean,
it's the same as your 10-minute doctor's appointment.
Yeah. Yeah. That's all the OHIP pays them for, right?
So. Right? Like, how can you get to the root of something when... And I think that's one of the things that I always pride myself on was I'll listen to you.
Yeah.
If we don't get to what we need to get to, then we don't get to it. But if I can fix you within 2 to 3 treatments instead of 6 months.
Yeah. Now saying 2 to 3 treatments, when you have a non-surgical injury, there's so many schools of thought on this, and like I'm curious to know this too, because each injury is different or each incident is different. But what is more productive in terms of rehabilitation, aggressive or a passive kind of therapy?
Aggressive.
If
you're only giving me 2 options, yeah.
Well, I mean,
again, everything depends.
Yeah.
Everything depends.
Obviously, like if you pull a muscle, rest for a few friggin' days. Yeah.
Yeah, for sure. But there, again, like the grand majority of things that I would have seen for the last 10 years of my career, right? The first 5 years, I was treating kids all the time.
Yeah.
80% were kids. So playing whatever sport, hurt themselves. In theory, don't play your sport for 2 to 3 weeks. Let's rehab it. Blah, you're back, right? Easy peasy. But with like the biomechanical injuries, you can rest for 24 to 72 hours, maybe depending on the severity. But you got to move and you got to do something. You have to make change to that tissue, whatever that means.
So one of the things I always kind of like, it might be an old school mentality, but I don't think it is. I think it's like this is just hard nosed being a freaking hardworking human. Is say you hurt your knee, right? And you get a sprain, you're out for 4 to 6 weeks, whatever. You still have an upper body, right? And one of the greatest things I take away from all of my injuries was that I kept working throughout it, because one, it kept my brain and my body active, but 2, there's literally a scientific principle of blood flow. The more blood flow you put into your body and get into your joints, the faster you recover.
Yep.
Do you think that that's one of the biggest reasons of why the aggressive approach is better than the passive?
Yeah, I would say so. I think and I know I keep on going back to this, but it's been a big part of my career that you can't take the psychological out of things, right? Once the physical has actually rebounded, there's a whole lot of other stuff that you have to work on.
Yeah.
With people and regular non-professional athlete people too, right?
Yeah.
So yeah, from a literally from a physiological standpoint, blood flowing through your body, it helps to filter out the inflammation that's happening at whatever site it is. The oxygenation of all the tissue in your body, keeping the strength, again, depending on what it is and how long you're going to be not doing something with that joint.
Yeah.
You have to stay strong in order to compensate for that.
Yeah.
Right? If you're looking at something that you're on crutches for, if you've got this piddly weak upper body, how are you supposed to suspend yourself on these things?
Yeah. I mean, I got the knee scooter. They do make it easier to be lazy, you know that, right? But I will say this: the knee scooter did fuck my hip up a little bit.
Well, so then there you go. And I mean, think about how much we worked on your hip after your ACL too.
Yeah.
Right? Like that's a common thing with ACL patients for sure, is that you get, because you've been walking all hike, once you start walking, you're hiking your leg instead of using it properly. People start getting hip problems, low back problems. There's all that,
even to this
secondary complication.
Sorry, even to this day, when I had the pec surgery and I was in the sling for whatever it is, the 4 to 6 weeks after, I still get elbow jams. Like if someone was to punch my forearm, it jams my elbow, and there'd be a second of, and that was only because I was in the sling in that stupid friggin' 90-degree
flex position. Yeah.
And I mean, doesn't affect me in terms of things, but there's sometimes when something will jar my hand. I'm like, geez, no.
Yeah.
Right? So, well, I mean, it happens. That's what I think in my head. In therapy, there's so many different approaches by like a bunch of different professionals, right? I mean, this goes back to active and passive. But like I'll use one of the biggest examples is ice, right? When we were coming up, everyone's like, oh, you heard something, throw some ice on it and you'll be good, take down the swelling with the ice. And then over the last 3 years, 4 years, it's kind of come out, no, you shouldn't be icing injuries, you shouldn't do that. There's so many different contradicting approaches by all sorts of medical professionals, especially when it comes to orthopedic stuff like we deal with and you deal with. Why is that, and how do we kind of like get past it? Because I feel like it's kind of holding the game back in terms of rehabilitation.
And I totally thought about this last night when I was thinking about the kinds of things that we would talk about.
Yeah.
Because I am and was a strong proponent of icing.
Yeah.
For an acute injury. Right? So the whole theory, to explain to people a little bit more that generalized theory of not icing, is that people had theorized that when you acutely injure yourself, there's a blood rushing to the site, right, which carries with it certain chemicals that are trying to protect you from not further injuring yourself. Secondly, it's the body's way of trying to start to heal itself. Yeah. Right? So that technically is true. What this whole thing that you're talking about that started coming to the forefront about 6 years ago is that why would you want to stop that? That's the body's natural way of trying to heal itself, right?
Yeah, exactly.
Less about taking drugs, less about doing it. Okay. So I appreciate that. I appreciate that theory. As a therapist, if you're walking in and you're paying a good chunk of money to come and see me and get some advice, you want me to do something about the pain that you're in.
Yes, 100%. Right? Pain is the first thing people want gone, right? Yeah.
The first thing people want gone. Okay. So I would argue that, again, this is an acute injury. If there is swelling, getting rid of that swelling is the first and foremost thing that you need to do. That's not always icing it.
No.
That's more compression.
Yeah.
Right? So that you sprain your ankle, you wrap it in a tensor, you put a compression sleeve or a compression sock on it, something like that. That's going to make you feel 10 times better than just icing it.
Yeah. And that's
right? Because that's containing
The
People
swelling.
can't see me, containing the the eruption of fluid in your
Yeah.
body that's causing the compression on the nerves. It's causing a lot of pain,
Yeah.
right?
Yeah.
But icing your ankle for 15 minutes every couple of hours is not delaying the
Yeah.
heal. In my personal opinion, sorry, in
No.
my personal opinion, that's not delaying the healing significantly. Those processes don't stop permanently just because you've iced it for 15 minutes.
Yeah. That's the, and
You are sending a signal to your brain that something is now numb,
yeah.
so that you can chill on the couch and watch
Just be
Netflix.
pain free. Just be pain free for a few minutes, right?
Right?
Yeah.
So, and not that I subscribe to this, but there's other parts of rehab where pain is inhibiting the person from actually doing something that they need to do.
Yes. Like a herniation in the back.
Sure.
Yeah, because
Right.
that's a great example, like, where I had a herniation. I've had everything. I had a herniation. It caused a sciatic, which debilitated me for 6 months until I was finally able to alleviate the pain and then properly rehabilitate the
Right.
injury.
Right.
Right. So, I mean, the going back to what you said about compression, when I had this most recent surgery, um, I could ice as much as I wanted to, and it made it feel good. Like it made it feel good. Like when things are swelling, the joint feels hot and heated.
Yeah. Yeah.
So it made it calm down in terms of that. But the only thing that actually moved the swelling out of my ankle and allowed me to perform day to day walking without discomfort was a compression stick.
Yep.
And like I'm not knocking on the icing, but I think this is one of the things you've always told me was if it feels good, do it.
Yep.
Right. And I think that that's something more therapists and more doctors should kind of go with other than textbook, because as everyone nowadays with all the COVID shit, trust the science, trust the science.
Yeah.
Well,
Yeah.
sometimes the science is right, but there are alternative ways that just work for each individual body, because everybody's body is different. Everybody's pain threshold is different. Everybody's neurological connections are different. So what is textbook is not necessarily what's going to work for that human being, right?
Nope.
And but why do the professionals, like, is it just an arrogance to their specific field of rehabilitation that they don't want to do it this way and that's the only way?
I don't know whether it is in I don't know whether it's that, or whether it is you learn a certain way,
Yeah, and you're kind of just stuck with it.
you stick with it, you learn a certain way, you believe in it,
Mm,
so you continue.
yeah,
Um, you learn a certain way, you don't read or you don't listen to literature that comes along.
yeah.
Um, or that you learn something and you're just sort of stubborn.
Yeah.
You know what I mean? Like it's one
Well,
of
if
those. And I
yeah,
was stubborn. I had
same
opinions
with
on
me.
certain
Yeah,
professions. I had, you know, thoughts on how things should be. I can't believe someone is saying that sort of thing.
yeah,
And what I say to people in terms of my advice, especially with exercises, because that's the toughest thing to get someone to buy into
yeah,
a lot of the time, is prove me wrong.
yeah. And
I'm
it's
suggesting something, go and do it. If it doesn't work, we'll try something else. Like I've never, again, probably in the past 10 years, this is my suggestion based on what I'm looking at right now, but I am more than willing to give you a different option if that doesn't work for you.
well, and I feel like that's why the world is so fucked up right now with what's going on, is because the approach that we're using for our pandemic responsing and stuff is, this is what we know now, right? This is what the science tells us now. And in terms of this, I'm not just referring to COVID. I'm kind of just trying to relate it to people so they can kind of get a better grasp of what we're talking about. Um, we know how it functions. We know how this stuff works right now. but in 3 months, we're going to do more studies. We're going to have more control groups. We're going to have a lot more data. So things are going to change. And then in 6 months, things are going to change. And in 12 months, things are going to change. So we can't get caught up with what we know now as being the end all be all. And I think that's, you know, when people talk about, I studied science. I have a science degree. Same with you. I love science. But when you get philosophical about science, a theory is the theory, right? It's not
Mhm.
a proven fact. And um, even a fact 300 years ago is not a fact anymore. Facts change. Like, uh, um, I think we get caught up in this thing that a fact is this is concrete proof. Like gravity is a
Well,
fact,
yeah,
right?
other than gravity, yes.
Other than gravity.
That's what
Gravity is the fact.
we figured that one out.
Figure that one out. But the rest of them, if you look at the world philosophically, and if you look at things that me and you do in terms of strength coach and professional sports, and you in terms of rehabilitation, I don't believe that there is a such thing as a fact. I think that there are things that work for people, and then those things kind of change over time, right?
Yeah, I mean, I would say that the fact is the structure.
Yeah.
The fact is the physiology,
Yes. 100%.
right? So virtually within 95 to 98%, the same stuff is happening within a person's body,
Yeah.
right? We've got definitely different, again, that's beyond my scope, but we've got definitely genetic micro differences,
Yeah. Yeah.
right? Some people don't respond to certain medications.
Yeah.
Some people pass out from an Advil. Like
Yeah.
it's quite interesting to me
I,
from that standpoint,
I
right?
throw up for an anesthetic, and some people don't, right?
Right,
Yeah.
exactly. And some people's bodies just, you don't experience pain. Some people, cut their finger on whatever and they're in agony for a week. It's the way, those are the differences.
Yeah.
And from what we do, what we try, and I think our similarity is the exercise part of it
Yeah.
and the wanting to help people and wanting to teach people, and try and gain a body awareness, which is very difficult.
Yeah.
That's very intrinsic, and you don't have to be a top level athlete to have that. But you, what we're trying to do is to teach people so that they can help themselves,
Yes.
right? Use us as a tool, but us as a tool, we're supposed to have a wrench and a hammer
Yeah.
and a screwdriver and you know what I mean? Like that's the quintessential kind of metaphor of your tool belt. So and so wants to do such and such. Well, you know, 6 out of 10 people might be able to do the same thing
Yeah.
to achieve that goal, but those other four are going to need some tweaking and some alterations, right?
Well, I mean, this is what I kind of tell every client that I've ever had, and anybody who inquires to work with me or train with me on any level. It's I am not like I'm not Good Life Fitness. I'm not um, LA Fitness. I am not chasing a paycheck, and I'm not chasing money from you. I don't want somebody feeding my bank account every certain amount of days because they are reliant on me. My goal as a coach, as a human being, as a martial artist is to give people the tools to be able to do these things themselves and still come see me so that I can give you even more from my expertise. So I don't want someone coming to see me 3 times a week for 10 years. Then to me, I haven't done my job really well. I want someone to come see me 3 times a week, maybe for 6 months, and then twice for maybe 2 years, and then once a week for another year and a half. And then, we gotten you there. You know how to exercise. Now you just come and see me once a month because you want to, and we do some new fun shit, and you add it into your repertoire. And that's how I view my business, my training business. That's how I view martial arts. That's how I view everything. And I feel like the medical profession doesn't really follow that, so to speak, because I think a lot of things are money driven, obviously.
Yep, of course. Yep.
In terms of if we look at the world right now, pharmaceutical driven, where it's not so much person oriented as it is business oriented.
Yes.
And if we can get away from that as health practitioners and health, like as a physical trainer, like because when you walk into a Good Life or a LA Fitness, I hate to pick on them all the time, but they always give me material, right?
Well,
Right?
the
Uh,
biggest target. So yeah.
yeah,
Yep.
they sign you up for membership, and then they try to sell you on a personal training package. It's just how it goes.
Hmm.
And some people get roped in, and they're stuck with payments they can't afford, yada yada yada. Some people they just don't need it. They're independent. They just don't need it, but they get forced into these situations, and then it kind of loses their passion for things. And because of the financial driven behind of what we do of helping people, and I mean, I feel like I'm rambling now, but it's a piss off because it actually hurts people in the long term, right?
Hmm.
And it goes back to what you're saying is this is why people are turning to like WebMD instead of actually going to see somebody, right?
Yeah. Yeah. Oh, for sure. Or buying the latest, greatest thing you can leap on top of or have pummel into your leg. You know what I mean? Like
Yeah,
that's all those apparati that are part of the rolling out family or the fixing this family,
yeah,
right? Think about how many people you know have 5 to 6 of whatever late night infomercials are
yeah, yeah.
happening as
I know what you
well,
mean.
right?
Yeah, yeah.
As
The
opposed to
quick fix.
seeking
Yeah,
out, there's $1,000 right there.
yeah.
Whereas you could have sought out a half decent professional that could
Well,
teach you.
I'll give somebody something here. This is something that I've literally, and I'm giving this away for free. I'm not even charging this shit. But it's a very simple exercise, a terminal knee extension. I have literally solved. I can't count how many knee problems with people who have asked me, like not even clients, just people. I have a knee problem. Do terminal knee extension. You put a fucking band around your knee, and you basically kind of forcefully hyperextend your knee, squeezing the quad. It's something that you showed me during my ACL rehab, um, and I have never touched a leg extension machine since.
Yep.
And it has solved almost everybody who has come to me with a knee issue. Um, and that was just because I just it works. It's a valid tool that works. There's no financial gain from it, right? I don't gain anything, but it's a working fucking exercise. It solves the problem. But you go see somebody for a knee problem, they'll give you a whole fucking slew of shit to do, and it won't solve the issue,
Mhm.
right? But the solutions are always there. I feel like I'm rambling now, but I don't give a shit. I'm gonna keep the the solutions are there. It's just I find like sometimes in the industry, we're in a health kind of field, but it's kind of shitty because um, personal gain kind of gets involved with the
Yep.
industry.
Yep.
There's something as simple as that one exercise that can solve literally a slew of different knee problems, meniscus, tears, strains, sprains, whatever the hell. All you have to do is tell the person to do that and get out of here, and they will be healthy. Instead, because they want something long term from them,
Yep.
um, that's what happens, right?
Yep. Yep.
And how do we fix it? I don't know how to fix
I
that.
don't know how to fix it either. It needs the industry needs to change, and that's beyond you and I. But it's again, I have always said that I would rather, and it was exactly what you were saying. I would rather have, people have to eat and pay their rent, but like I
Yeah,
would rather have 2,000 people that trusted me and believed in me and came and saw me 2 or 3 times a year because they knew that I could fix whatever was wrong with them, as opposed to having 100 people come 3 times a week for
yeah,
6 to 8 months. You know what I mean?
I know what you mean.
It's as a therapist. I've always said as a therapist too, or even as a strength coach, like how do you feel like you're doing something?
Yeah, if you
I
have
mean,
this,
I got into this to try and help people.
yeah, exactly.
How do you wake up every single day and say, "Oh, I've got the same people.
Yeah,
They're not feeling any better." Like, what do you say to yourself?
yeah, exactly. And okay, this is totally off topic, but I do my bad. I
Gotta
just
get it
want.
in.
I was like, I gotta get it in before we finish. There's one specific procedure that I it has been so advanced over the last couple of years. It just like because it's such a like a hip replacement,
Mm,
right?
mhm.
I like I've never had a hip problem. This is not something, not one of my many thousands of surgeries I've had. Um, but it's advanced significantly to the point where a patient can go in, get a hip replacement, and walk out the same fucking day. Whereas there's stories I've heard from like I'm sure you never heard of John Danaher. He's a famous jujitsu coach where he's had a hip surgery. It ended up shortening his hip, and he can't do shit anymore. It led to a knee surgery. How has I mean, science and medicine is marvelous, but how has that specific one sort of just advanced so significantly from the time?
I think again, so materials have changed,
Yes. Oh yeah.
right? So the material that they use has changed. The actual procedure hasn't changed that much. I think it's like a lot of things. It's sort of like it's like having a baby,
Yeah.
right? Like you're out in what 18 hours now or something like that.
If you're lucky.
When you have a kid, it's like, oh well, time your parking's there, like let's go kind of thing.
Yeah.
Nobody's babying you for anything other than life threatening stuff, right? And again, okay, I'm going on a tangent, but
Yeah.
from to relate to being in an ICU for bypass surgery,
Yeah.
right? I used to think, oh my God, what a horrible thing to have happen. You must be in the hospital forever. No, you're in there for 2 to 3 days
Yeah. And then you're out. Yeah.
and then you're out, right?
Yeah.
So the same with babies, like you're out within 24 hours.
Yeah.
That's a,
Sometimes, depending on the severity,
it
obviously.
depends on whether it was just regular hunky dory fabulousness or whether there were complications. And I mean,
Yeah.
that works for any kind of procedure, but hips now, my parents they've had three amongst the two of them, and my dad's waiting for his second.
Yeah.
And they were in for I think 36 hours
And out.
and then out. And so I think that's the biggest, and I'm in full support of that,
Yeah.
obviously. I think that's the biggest change. And so the materials have changed. The smoothness and length of time that it takes has changed
Yeah.
for the better, but the literal process and biomechanics are exactly the same. And they're just like, get your butt moving. They've got a physio that comes into your room while you're at the hospital,
Yeah.
getting you to move. They've realized that, and it goes back to the ACL too, they've realized in the past 20 years that, especially with orthopedics, with something, and I think the joint replacements are pretty simple because it's like lickety split.
Yeah.
You know, chop chop, drill
Chop, chop,
drill.
drill, put it
You've
in.
got new stuff, right?
Yeah.
That's being the soft tissue that it once was, or the degraded harder tissue like cartilage. But it's see you later. Get your butt moving and start getting these muscles to support whatever we've
So
done.
it all comes back to basically a more aggressive approach
Yeah.
to injuries and therapy and basically orthopedics in general, right?
Yep, most definitely. And I think you're getting. I mean, the crummy part is usually people who do joint replacement are the older
Yeah.
generation of surgeons. No young fancy person wants to be doing joint replacement, right? That's not where you get famous, but it's still very important to do it properly and to not cause infection. And you're dealing with a population who's going to hold you accountable
Yeah.
as
Exactly.
well, right? You've got
Cancel
some
culture.
older. That's right.
Let's cancel the surgeon.
That's right. You've got some older generations that expect a little bit more.
Yeah.
And it's a very important, not to take away from it. It's a very important. My mom is like night and day
Yeah.
with hers in terms of pain, like a chronic pain that you're dealing with. It's like night and day.
Yeah, and I've seen that in a few people too. That's why I wanted to ask you why it was like that. But before we wrap,
I
sorry.
honestly, I think it's getting people's bums moving instead of keeping you in a hospital bed / in your own bed.
Yeah,
You all with any surgery, you have to respect the integrity of the incision, how small or
obviously.
how big it is.
Yeah,
You
because
cannot have
infection.
infection,
Yeah, yeah, you
right?
don't.
You don't want separation of the tissue because that delays healing. That delays rehab.
Yeah,
If every time you stretch the tissue, you're opening things up again, that's a problem. Um, but do the stuff that you can do.
yeah, and
Do some knee, if you're talking about a hip replacement, do some knee activation, right? Do your terminal extensions, do your ankle pumps.
yeah, just get moving, right?
Just get moving. Yeah.
And before we wrap this shit up, I had to ask you one more thing, because it is, I mean, with all the pandemic stuff that kind of taken a backseat to this, but the alternative treatments of PRP and stem cells. Um, something I haven't had the privilege yet of using those treatments, but mostly because they're not very accessible here in Canada. Compare They're slightly more accessible in the U.S., but there's a place out in, because of the laws in Panama, where literally thousands of athletes are flying to, and they're shooting these guys up, and they're having tremendous results. I know Mel Gibson went on Joe Rogan's podcast. I don't know if you saw that one, and said his dad was in a wheelchair, couldn't walk, went down there. They did the full body stem cells. The guy's up out of the chair moving.
Yeah.
There's thousands of athletes who have done those kind of therapies.
Yeah.
Uh, why are we so behind in North America with that? Is this a political issue? Is this because the evidence is there that these treatments do work quite well? Um, is it money driven? Because if they do work, obviously surgeons and other doctors will have less business. I can't put my finger on it of why it's happening, because even when I had my two kids, I wanted to keep the fucking placenta, not because I wanted to be like Kim Kardashian and eat it and shit, but because I know there's money involved in that, and literally I watched them take my wife's placenta and just do shit to it and take it. And I'm like, I want that. That's hers. That's mine. But it's illegal here to even, you know,
Mm.
do that.
Hmm.
Why is it? Why are this valid form of treatment that it does have the research behind it and does have the results, something that we're not using?
Um, so, in my opinion,
Yeah,
this is based on virtually nothing.
yeah,
Um, so, first and foremost, both those treatments are incredibly expensive.
yes, I know that, and
So, we'll start with that. Is that any new treatment does not automatically get covered by OHIP,
I'll hope it.
right?
Yeah,
So, and we won't go into some of the fraudulent things that you can do in the
yes,
OHIP system as well, right? So, taking things strictly as they are, new treatments, especially in Canada. So, I've had a handful of patients that also worked for pharmaceutical companies.
okay,
They were trying to do, in my opinion, again, I know these people, right? So I know them at a certain level. One of them worked for a major pharmaceutical company that was trying to get, now we see it on commercials all the time about the diabetes, like the kind of like permanent stickum
yeah,
and the digital scanning and stuff like that.
yeah,
So she was trying to get that in Canada for 3 years.
and they just didn't let it.
That's a disease that we know everything about,
Yeah,
practically,
yeah,
right? They're not fixing it, but this is a method of people more easily assessing their blood sugar.
yeah.
It's way better than pricking your finger,
Stupid, but yeah, I see my dad do that
at
shit all
least
the time.
twice a day, kind
Yeah,
of thing. Um, and it's more accurate than pricking your finger. So
yeah,
again, you're in theory, and the pharmaceutical company would obviously say this, is that you're really lessening the amount of hospital visits or doctor's visits that this individual would have to deal with, right?
yeah,
It's Canada, and it's a good thing and it's a bad thing, is that we have very stringent health policies here.
yeah.
Think about how, okay, so again, I won't get into COVID with you,
Yeah,
but The U.S. just approved vaccines for kids
Yeah, I know.
today,
Yeah, I heard that.
right?
That's a
So
whole other
it's
topic. I'm not gonna get
yeah, it's
into
a
it.
whole which we're not going to get into, but
Yeah,
it's like it's the fact that Europe especially is light years ahead of us.
yeah.
Is that is it public health care? Is it Canadians? Is it the fact that we're a fraction of the population of a whole bunch of other countries that are doing this? Is it we don't have enough money in research? Is it that we like to be the guys that,
Do things last.
do things last? Yeah,
Yeah.
that's exactly what I was going to say. Do we want to use other people as examples first? Right? That's a
Ba-
grand
ba-
scope.
Based off the pandemic, I don't think that that's the truth in terms of do things last. Off of how public health has handled things. Um, but I mean, these treatments, I have multiple people tell me that it has worked for them. Like obviously because
Yeah,
they're expensive, not a lot of people are doing it. But I'll give one example, just so people understand. There was when he had a calf injury as a fighter. He had a calf injury, nothing major. I think he just tore the muscle a little bit, but the calf wouldn't heal. He was 18 at the time, 5 or 6-0 as an amateur. Wanting to turn pro really badly, but he just this calf injury was just incessant. The tear wouldn't heal. They tried every type of therapy. So now he's like 20 years old and getting frustrated, right? Because it won't heal. This little tear won't heal. So they shoot it up with PRP. Within 3 months, the kid's fine.
yeah,
And he's turned pro and he's fucking fighting at a fantastic high level now. Nothing worked except for the PRP shot,
yeah,
right?
yeah.
And we're not talking about that stuff. And I think that, you know, and this is just me putting on my tinfoil conspiracy theory hat, is a lot of it has financial
100%.
impact
Yep.
on certain people. And I think it's fucking as healthcare and health providers and somebody who wants to help people get fit and healthy, I think it's freaking terrible that there's a treatment out there for so many different ailments, like sprains, tears, that can literally make people avoid getting massive surgeries, and there's no discussions about it. And it's valid, and I think more work needs to be done in terms of research and stuff, because I have heard stories where people shoot themselves up with stem cells and it didn't do anything.
Yep.
Right?
PRP the same way. Yep.
Yeah, and it didn't
Yep.
do anything, which is
Yep.
valid. Not every treatment works. Like if I go for acupuncture, it's not going to work for
Nope.
everybody, right?
Chemo doesn't work for everybody either.
Exactly. But
Yeah.
I think it's a big hit to humanity that there's this definitely a huge scientific leap in the fields of orthopedics, in the fields of rehabilitation, and even athletics. Um, that it's kind of just no one wants to do it because I feel, and this is my opinion, I feel if stem cell treatment and PRP treatment became regular, became something that was normal, like, oh, I've pulled my quad, I want to get back into the game next week. How can, yeah, shoot it up with PRP. It's going to accelerate that healing process by 100%. You're going to be there are a lot of people who are out of a lot of money. And when I say that, I mean doctors, healthcare
In a
providers,
privatization standpoint,
in a
sort of, is what you're,
privatization,
yeah,
and a
yeah,
lot of people, and that specific treatment is being held back by money. In my opinion, it's an expensive thing, but it could be brought down in terms of cost by making it more publicly available, because then competition will occur and the free market will help drive the cost of the service down.
yep, yep,
Right. And
yep.
and this is just my opinion and I'm putting my tin, but I feel like it's all because of how the potential of how good it is. And like I say potential because more work needs to be done with it. We need more people that need to use these therapies to see the results. But because of the potential of it and how highly effective it can be, it's kind of being suppressed a bit. Is that?
Yep. On both ends, I would say. So I would agree with you. Definitely, it's financial.
Yeah.
So it's that we'll call it a market price,
Yeah,
has been set at about $700.
Yeah.
So now you publicize this. It's part of OHIP. Probably they're not going to pay $700.
No, they won't. They barely pay $10, right?
So now the physicians that are doing it are not going to get their $700. They might get $300.
Yeah.
Right?
Yeah.
This is a discussion for another night. But this is it is the problem, and a bigger problem, this is a global statement, is that we are not, and I'd say whether you're a private healthcare or public healthcare, whatever, tons of countries are not into prevention.
Yes, they're into after the fact.
Right?
Yeah.
You don't make money in prevention.
Yeah. And yeah, that's a great
from a government standpoint.
Yeah,
if you want to go big government aspects of things.
No,
right?
you're right. And I mean, COVID aside, that's obviously seen with some of the COVID kind of stuff that's happening in the world right now. So I mean, it's just a travesty, because I think that in terms of just the fields of just health in general can benefit so much from it. And I see the potential. Tons of other people have seen the potential, and it's just, I think that that's one of the reasons why, is because it could literally be a game changer. But then the money aspect, that $700 a shot, will obviously be driven down significantly because of competition. And yeah, and I mean, we'll wrap that up with that. But I mean, it's a travesty. I mean, I don't know if there's anything that can be done about it other than keeping the talking about it. I think that more people need to know about it.
Yeah, I think it needs to be, I mean, again, not going into it, it's going to be one of those things where the rich get what they want.
Yeah.
And the people who can't afford it don't. And again, that's a global statement.
Yeah.
But it's that type of treatment. So PRP especially is very specific.
Yeah.
Right? It can't treat everything.
No.
But those chronic tendinitises and tendinosis and those long-standing scarring type injuries, it has worked like magic for
100%
for a lot of people.
Even
right?
Even when I went to the Cleveland Clinic and Dr. Miniachi assessed my knee and said you don't need surgery, he's like, I wish I saw you when this injury happened, because if we had shot it up, I guarantee you would have had significant healing in the actual ligament instead of now just it's going to scar and you have to rehab. And even he said that. He said it's a shame that you had to jump through these hoops before you got to me to see me to make this diagnosis, because he's like, definitely for sure, if we shot the knee up, even with just one shot, if that's all you could afford, you would have had at least a 10% tissue regeneration. And I would take 10% for $700 any fucking day, right? Right? And I'm sure a lot of other people would take that too, especially if they were in a lot of pain. Anyway.
And I think that, sorry, I just want to say, because I don't want to say that this is all about people with money. It goes back to our conversation about practitioners presenting all options. And in as realistic and unpressuring manner that they can, right? Present things objectionally, and it's just sort of like, these are your options, this is how much it costs, this is what you can do via OHIP, and informed decisions and informed consent is what the medical profession is all about. Right?
That doesn't exist anymore.
Well, it doesn't exist for a lot of people, but again, going back to what we were talking about, is that I think there needs to be more people, practitioners, strength coaches, people in the health field that you are already paying for their services, right? You've already consciously made a decision to come to one of us and give us money for our knowledge. Is that as that practitioner, you have to give that person as much information as you possibly can. And then it's up to the person
to make that decision.
To make that decision and to do what you've suggested they should do.
And there you go. Let's wrap this shit up, because I know you gotta go to bed and I gotta go to bed. I got these two
right? You have people that might wake you up.
Two little assholes. I call them little assholes. Anyway, thank you so much for doing this. We got to do it again sometime.
Thank you for asking.
Appreciate your expertise. if people want to come and see you for some treatment, where can they find you?
So I am at the Movement Lab in Mississauga.
All right.
That is 3611 Mavis Road in
Just
Mississauga
just
at
Google it.
Burnthorpe.
Just Google it,
Just Google it.
fuckers. The Movie Lab. Ask for Moira Swain,
That's right.
one of the best in the game. All right. So thank you everyone for joining me for another episode of Grind My Gears, and that's it. Have a great day. Peace out. Everybody, thank you for watching. Please do me a favor. Click the like below. Share on YouTube. Share on Instagram. Share on Facebook. Spread the word so I can keep creating more content for you and keep providing you with a great podcast experience. Peace out.